Okay, so welcome everyone to our webinar series. This is the American Congress of Rehabilitation Medicine, the Complementary and Integrative Rehabilitation Medicine Networking Group. And I am the chair of our webinar series. My name is Matt Erb. I'm a physiotherapist located out of Tucson, Arizona, and also an associate clinical director with the Center for Mind-Body Medicine in Washington, D.C. And what I'd like to do is ask my co-chair, Peishan, to introduce herself next.
Hi, everybody. I am Peishan Wen. I'm co-chair of this hot topic webinar series. And I am also assistant professor in occupational therapy department of Georgia State University. Our speaker today is Kellie Finn, and her topic of discussion is on breath and healing. So before we get started with presentation, I do want to advise that this meeting is being recorded. I would like to ask all attendees to keep your phone and mic mute. And we do expect to have about 5 to 10 minutes available for discussion at the end of the webinar. So if you have any questions, please type them in the chat feature and we will address as many questions as we can.
Great, thank you. And I also just want to add one other tip as Kellie is getting her slides shared up on the screen for us here, and we'll introduce her in just a moment. But once the slides are shared, know that you can resize the proportion of your screen that shows the slide versus the speaker's video. There's a little slider bar in Zoom between where you see the slide and the videos, and you can slide that left or right and resize your window for your own preference for viewing. And with that, it's my pleasure to introduce our guest speaker. Kellie is a graduate of Maryland University of Integrative Health, where she currently works as a clinic supervisor at the Natural Care Center and Howard County General Hospital. Her study of yoga as a healing modality began 30 years ago while serving as a summer volunteer at Omega Institute, followed by exploring yoga as a lifestyle during 2 years of service at Kripalu Institute. In her 20 years as both a yoga therapist and instructor, she has worked with universities, wellness centers, chiropractic offices and gyms, corporate organizations, and studios. As a yoga therapist, she specializes in helping individuals disassemble destructive behavior patterns associated with trauma. We look forward to your talk, Kellie, and we'll now turn the presentation over to you. And thank you so much for being here with us today.
Thank you, Matt. Thank you for that introduction. And thank you both and the ACRM for this opportunity to speak. It's an honor to be here to talk about the breath and how it can be used as a healing tool. I don't have any disclosures. I do have a few disclaimers. I'm not a respiratory therapist or a specialist with the breath. My experience with doing breath work with individuals and using it as an element of sessions comes from about 3 decades of studying and practicing yoga as a lifestyle, as an exploration for how to live and how to heal. And I did have an interesting experience when I first moved to Kripalu. I'd been studying yoga for a couple of years and experienced it more as a form of exercise. And I had come to Kripalu after visiting my family up in Maine for Thanksgiving. And at the time I was struggling with an eating disorder and with some behavior patterns that were pretty self-destructive. And after Thanksgiving, the day after Thanksgiving, I went for a run. And it was freezing rain. I was wearing shorts and a t-shirt. I went for about a 3-mile run and I came back and I was blue, like literally blue and shivering. And my father looked at me and asked, like, what are you doing? And so when I got to Kripalu, one of the things that I was looking at while I was there was that, you know, I had this relationship with the body and with exercise that was unhealthy. And so I put myself on exercise restriction for about a month, and my practice became just doing breath work. And I expected after that month, when I got back on the mat, excuse me, that my yoga practice would have diminished. And what I found was that I actually had more flexibility in my body, more range of motion, and more access to my body. And that was the kind of the turning point in being curious about the breath and how the breath might be utilized as a tool as much as, you know, asana and philosophy at that point. So the objectives, apologies for that, objectives for today are to try a few practices out. I'm an experiential learner and teacher, and so I'm all about, you know, get in there and do it. Looking at how breath can support work in sessions and beyond sessions, and looking at different types of breath work and how they can be either stimulating or pacifying depending on what you're working with, what's being presented. But my personal agenda is to provoke curiosity and to emphasize that if you are wanting to use breath as a tool in sessions, or if you're wanting to use it as a tool for yourself in your own process of self-discovery and becoming or healing or whatever that is for you, you have to utilize it. So my hope is to inspire the experiential, and hopefully the experiential brings more curiosity, and more curiosity brings more experiential, so it becomes this nice loop. When we're looking at why a personal practice is important as a facilitator, we all understand neuroplasticity, and that our brain, what we focus our attention on, is what's going to increase in our awareness and our experience. So the more familiar we are with our own breath, the more we're just going to start to naturally notice that in the environment and the individuals around us. The more that we work with our own breath, the more that we engage with it, if we look at different practices, different ways of utilizing it, or just simply noticing it periodically over the course of the day, the more comfortable and familiar and confident we're going to be, and the more we're going to start to notice the patterns in ourselves and patterns in others. And also, that individual work that we do is going to help us recognize that breath is so unique to each individual, the rhythm of the breath, the patterns of the breath, and the reception of breath exercises, or breath as kind of an element for care. And our familiarity is gonna help us pivot and be able to kind of creatively apply it, have a range of word choice, understand how to use props, how to explain why we might be offering a particular breath practice to explore. So it's just gonna enable us to, be creative in our application. All that said, we are going to do a little breath practice now. If you have a piece of paper nearby, I invite you to just close your eyes for a moment and just jot down 3 words or 3 phrases that capture how you're experiencing your body or your breath or your emotions, anything that you notice about this moment. So just 3 words or 3 phrases. And then just putting that aside, take a moment. If your eyes can close, please close them. If you can't close your eyes in this moment, you might focus your gaze on something and just let that periphery around that soften. And let your attention wander into your breath, not to change it in any way, but just to notice how the breath is in this moment in your body. You might be noticing as you inhale where you feel that inhalation, where it starts, how it moves. You might have visual associations or images or a concept of texture with the breath. You're just pausing for a moment and noticing what you notice. And does it change as you watch. And then we are going to shift into a particular patterning with the breath. So you might place your hand right around your navel so that the pinky and ring finger area are over the navel. The rest of the hand is resting softly on the abdomen. And for the next 1 to 3 breaths, 2 or 3 breaths, how much can you invite the breath just to fill this particular area of your body? Waiting for the natural inhale to start and then just gently nudging it, inviting it to expand circumferentially, even in all directions. Next time that you naturally exhale, taking your hand, if you're using it up a little bit higher now, so it's resting on the sternum, the metaphorical heart area. And for the next 2 to 3, maybe 4 cycles of breath, how much can you bring the breath just to this area of the body as if you could only breathe into this pocket, this section? You might also be noticing the beat of your heart in your palm. You might slide your hands to the side using both and see if you can widen the rib cage the next time that you naturally inhale. And you're just waiting. You're waiting for the natural inhale, and then you're using your mind to direct it. There's no rush. The next time that you naturally exhale, your hands are going to come up higher, and you might switch sides. So the right's on the left and the left's on the right. Or same side, they're going to rest right around the clavicles and collarbones. And for the next 2 or 3 cycles of breath, is it possible to isolate the breath just into this area of the body? Again, there's no rush, no need to force. It's just a sweet, gentle invitation. How much can you breathe here? And the next time that you naturally exhale, one hand is going to stay up in this area so that your thumb and your index finger are resting on the clavicles. The other hand goes back toward the abdomen. And waiting for the natural inhale now, pouring the breath from base to middle to top with each cycle. Noticing where that feels easeful, perhaps where the body might be a little shy or resistant. Each time that the inhale breaks in the body, using your imagination, your focus of attention, pouring the breath base to middle to top. No rush. One more round of this, one more widening, radiating out in all directions, like water pouring in a glass, base to middle to top. And when the body naturally exhales, releasing the hands, just taking a moment to travel through your experience in this moment, eventually opening your eyes and jotting down 3 words or phrases now that reflect what you notice. They might be the same words, they might be shifted. It's very strange. We lead a breath exercise and not see bodies. So the exercise that we just did is called Dirga breath, or 3-part breath. It's a parasympathetic nervous system breath. We started with what's called the natural breath. So the natural breath is where we would start with anyone if we were introducing a practice. And it's just an invitation to, start to build a relationship with breath. It's bottom ground invitation to start to notice. And one way that you might incorporate that in is you might set a timer on your phone multiple times a day that goes off. And when it goes off, you just take a minute, close your eyes, you notice your breath, you kind of take stock of what you notice, and then you move on with your day. So you're just building this pattern of attentiveness to the breath. From there, we start to play with building into Dirga breath. I usually use this as an introduction breath. And it, in and of itself, it helps to build concentration. It helps to build interoception. Helps to build that sense of witness consciousness, that ability to observe ourselves without reaction, just noticing what's happening. And over time, you might notice that it starts to invite a deeper breath overall. You might even feel that you start to kind of sigh here and there, that your breath just becomes something more regulated in your awareness and more attended to by your attention, that you actually choose to take deeper breaths. The next slide shows the ideal 3 parts of the body. We cue it to the breath, we cue it to the mid-chest, we cue it to the upper breath. Obviously, we can't breathe into the belly, we breathe into the lungs, but it's this idea of filling the lungs completely. And ultimately, that deepening of the breath, that invitation of the breath to go all the way down toward the base of the lungs. The base of the lungs is where the most blood flow is. So we're also going to heighten that exchange of CO2 and O2, of oxygen and carbon dioxide in the body. So we're better fortifying our body overall, our cells. This breathing pattern also engages the diaphragm, and the diaphragm is the main muscle of breathing. It operates about 70 to 75% of our breathing pattern, complemented by the intercostal muscles and then the axillary muscles in the neck and the shoulders. And the diaphragm influences our posture, it influences our locomotion, it influences our digestion and the pitch of our voice. It influences such actions as like sighing and yawning and coughing. It influences our emotional animation in our body, and it supports things like defecation and urination. We feel it when we're vomiting, that ability for the diaphragm to have the full range of motion that's necessary for it to operate in the body to support our well-being. You might have noticed that particular breathing pattern as well that particular breathing pattern as well naturally lengthens the exhalation and might even incur a bit of a pause at the end of the exhalation. And the lengthening of the exhale and a pause at the end of the exhalation are stimulating. They kind of settle us into the parasympathetic mode. So this breath is used as a way to calm agitation, as a way to deal with panic disorders. And it's super important that the pacing of the breath, the leading of the breath is body directed. It's mind observed and body directed. So we're not forcing the body to breathe at any particular rate, but as we're naturally breathing, we're just supporting that process by directing it with our imagination. This picture here shows how we might do this particular breathing pattern with a client or with ourselves in different shapes. Prone position, this middle position where we're in what's called child's pose in yoga. This is going to give us way more access to lung tissue in the back plane of the body. It's also going to help if we're struggling with a disassociation experience to settle into our body a little bit deeper, because we're feeling the expansion of the belly into the thighs. We're feeling the expansion of the chest all the way up. Lying on the ground here, this is an image of Donna Farhi from her book, The Breathing Book. This is, lying on the ground automatically starts to stimulate the parasympathetic mode as well, because we're not having to hold our body up against gravity. And that can also give us feedback through the back plane of the body. So Yeah, and these are just kind of listing out the aspects of the Dirga breath, the 3-part breath. So I wanted to move on to this slide. So when I think of breath and the body, or breath and our experience in the body, it's kind of like a chicken and egg experience. We probably all know this form. We've been on Zoom a lot this year. And there's a natural pattern that starts to formulate unconsciously when we get online or when we sit in a position for a long period of time, where we tend to, especially if we're focusing on information, we're getting super cerebral, we tend to start to upper chest breathe and rely more on the auxiliary muscles, the neck and the shoulder muscles, than on the diaphragm itself. And over time, this can create chronic tension in the neck and the shoulders and the pectoral muscles. It can create a disturbance in the ideal curves of the spine. It can create tension in the front of the hips, a tightening of the psoas muscle. And the pattern over time, we get up from our desk, we start to walk around, we don't really notice that we're upper chest breathing. So that becomes a pattern that we maintain, even though we're no longer in that particular shape, our body is still holding the shape. It's also, the body can shape itself around trauma, the hypervigilant state. Disease process can shape the body. Different issues with the spine, respiratory disorders, kind of self-image, self-esteem issues can change the shape of the body, and that can affect the depth of our breath. And then two, the change of our breath can affect how our body moves through space, or the movement of our breath can start to, like the pattern of our shortened breath over time can start to instill disease. So when we're working with clients, there's the understanding with our breath that there's so much that influences over the course of the day. And when we're working with clients, or when I'm working with someone in particular, I'm listening for certain conditions that they have, or certain symptoms that they have, that are going to cue me to look at their breath more distinctly over the course of the session. If someone reports to me that they're struggling with anxiety, with panic disorders, excuse me, with depression, with agitation, if they have excess grief happening, if they're dealing with foggy brain, if they've got cold hands and feet, if they're saying that they have allergies and they've been worse lately, if they're talking to me about headaches, or they've disclosed that they have current or past trauma history, then I'm going to look at their bodies, and as I'm communicating with them, I'm going to watch how the breath moves and how much the pattern of their breath might be influencing these symptoms, and where are places where that might be intervenable. The relationship between the breath and the body is bidirectional. So while I'm watching individual in session, while I'm doing a yoga therapy session, I'm also going to be watching for tension in the upper body. I'm going to be listening to the quality of their voice. I'm going to be noticing how that might change as they're in narrative, as they're talking about a story. Does the quality or speed of their voice change? Do they have physical mannerisms like a shaking leg, or do they tend to twitch? As I'm listening, or as I'm kind of holding space for the session, I'm feeling into the mood in the room. I'm noticing when the breath pauses, when they might have a pause or an absence of breath. And I'm also paying attention to my breath in the session to notice if there's a point where I start to shorten my breath, or where I start to hesitate, or I start to stop breathing altogether, as a window into what may be going on with the client. So if typically in a session, I'm using my breath, long, slow, deep breathing, to try to create a therapeutic, welcoming, softening environment. And if I notice that my breath pattern starts to change, it's a window into, is something happening with them that needs to be addressed? Or is there something that they've said that's stimulating something in me that I need to go address for myself later. Has bias arised? Has my own process been triggered? And so the breath becomes this hinge between the conscious and the unconscious, and an opportunity to kind of ripple to the surface things that need to be addressed, or something that somebody might have said that is worth teasing open a little bit more. Dennis Lewis, excuse me, has done some really great work in his book, The Tao of Breathing. Here, I've listed out different emotions that he's highlighting and how they might affect the movement of the breath in the body. And the most important aspect of this is that while there are patterns that we can address and point to, there's a strong encouragement to not make assumptions from that. So if I am noticing during a session that, somebody's breath has gotten shallow or irregular or quicker, or they're starting to kind of move around a little bit, or they seem uncomfortable, I'm not going to automatically assume that they're fearful or they're uncomfortable. I'm going to say, hey, I'm noticing that your breath seems a little short right now. Are you noticing that as well? Are you experiencing that as well? And what happens when you take a deeper breath? Maybe we can take a breath together. Or, in that your breath is shortening, let's just drop into the body for a moment. Can you tell me what you're experiencing in your body right now? And so noticing that pattern becomes an opportunity to engage deeper in inquiry, and to also help the individual themselves start to recognize through their breath, especially if they have trouble recognizing emotion, or if they're kind of stuck in patterns of emotion, the breath for them too becomes a window into what's going on. And then knowing different breathing exercises, knowing different ways to interface, gives them an opportunity to be like, oh, I am like really kind of uptight right now. Here I can play with this particular breath pattern and see if it allows me to settle a little bit deeper into myself, either to release an excess of emotion, or to kind of dig into and notice, like, what is triggering this? What is the narrative behind this? As I said before, for myself, when I'm in a session, I'm focused mostly on number 8 that's listed here, which is that I'm, as much as possible, just trying to stay attuned to my breath. We talk about kind of this 60-40 process as a facilitator, as a therapist, that, I've got 60% of my attention with the individual, but I've got 40% of the attention in my own body, just noticing my own reactions, my own breath flow, my own emotional registry, as a window into what might be happening with the person with transference and countertransference. So now we're going to switch gears a little bit. So if you have that paper nearby, again, you might just take a breath. Notice what you notice, jot down anything that you notice about this moment. And what we're going to do now is play with more of a stimulating breath. So eyes opened or closed, waiting for the natural inhalation, taking in as much breath as possible. So you might even play with that concept of pouring that nice deep breath into the body. Only at the end of the inhalation, you're going to tuck the throat just slightly to hold the breath in, and you're going to use your fingers or your fists to either tap or dough the body. The fists, we call it doughing. And you're going down to the sides of the ribs. You might do the belly. Again, you're holding the breath in. Do the kidney area, as much of the back body as you can reach. Hold for just another moment, tapping. Release that, exhale completely. Perhaps take a breath in between cycles. And then again, take a nice deep breath in, holding that breath in. And again, you're gonna tap. So you're just stimulating the body. The tapping also is a nice way to kind of elongate that ability to hold the breath in, which might feel a little agitating or annoying to you. Holding for one more moment. And then again, releasing the tapping, take a nice deep breath out. And one last time, take a nice deep breath in, vigorous, fast tapping or doing. And then letting the breath go. And again, just taking a moment to notice what you notice. Notice what you notice about your body. Notice what you notice about your mind. What you notice about your breath, your energy level. I'm recording anything that seems useful on that piece of paper. So with this particular breathing pattern, we're holding the breath in so that exhalation stimulates the parasympathetic nervous system, and the inhalation is more stimulating for the sympathetic nervous system, which might seem a little odd that you would want to stimulate that aspect of your being, but that's also responsible for your ability to be attentive and available, to be ready in the moment. And so this breath technique is great if you're feeling a little bit of sluggishness. With the tapping, it's really nice if you've noticed that you're in your head, like if you're on your computer for long periods of time, you might step back from your computer every 30 minutes or so and just do this so that you're keeping yourself nice and percolating mentally, but you're not kind of formulating any body concepts or breath patterns that could lead long-term to shifting your autonomic nervous system to be more in a sympathetic mode than in a parasympathetic mode. We want it to kind of vacillate between the two evenly. And so this is building up your tolerance, your individual tolerance for being able to be in that sympathetic zone without it necessarily kind of triggering anxiety or fear, anxiousness. There are other breath patterns that we might utilize. So when we're looking at individuals who might be dealing with long-term stress situations, if they've got a job that just has a really fast pace to it, if they're currently working as a caretaker for someone, if they are, working through trauma situation and they're kind of like in that process of digging through it and they're finding that their nervous system just feels a little off consistently. There are ways to take this understanding of how breaths can interface or intervene with the nervous system and sandwich them together. And what I mean by that is, if I'm working with somebody who has this job that they absolutely love, but their physical body is starting to show signs of stress because it's just too much, even though they love that adrenaline rush, which is too much for their body. I might work with them, teaching them, a parasympathetic nervous system breath pattern for sure. But I also might work with them sandwiching a sympathetic stimulating breath in between a parasympathetic breath, so that over time, what they're consciously working with their nervous system to do is to be able to be in a stress mode and then to come out of it. So, I might do a Dirga breath. I might do a sound-based breath where the throat is slightly constricted or the lips are pursed, and have that be something that they do for 3 to 5 minutes. And then they do something more vigorous, like a breath of fire, or it's called Bhastrika or Kapalabhati in yoga terms, or this breath that we just did, and then come back afterward and come back to that parasympathetic breath. So again, they're learning how to modulate their own breath and being, their own energy level and their own ability to respond. And then when the situation is over, to kind of step back and be in more of that relaxation, digestion mode. And the major emphasis on why breath work would be an interesting thing to explore more personally or explore more in session is that, here's this thing that we have anywhere we go. We don't need any equipment for it. We can implement it for any length of time. We can do it for a minute. We can do it for 5 minutes. We can do it for 10 minutes. We can do it for a half hour. Here's this tool that we have that allows us to build interoception, kind of have that dialogue with the inner realm. It's going to build sensitivity to the environment so that we're more aware of what is stimulating around us, or what our situation is that maybe isn't healthy for us, that we need to leave, or places that we need to go that are stimulating and healthy for us. It's going to just allow us the ability to be able to regulate what's going on with us from a moment to moment or a day to day living. And in that way, we have more agency with our life. We have more power in directing. So when I'm working with an individual, or when we work with an individual, there's all sorts of, before we're kind of intervening with some kind of breath process, there are things that I want to ask about or kind of investigate about what's going on with the individual in front of me. I want to know if they have health conditions that are pervasive or linked to stress. I want to know if they're, what the stress level is in their work environment, in their home environment. I want to know what the environment is like where they might do practice, so that I can kind of weave that into the practice itself. Like if they're going to do this with children, we can weave the children in and have them do it with them. If they're going to be in a noisy environment, I'm going to introduce different cues or introduce different ways for them to have concentration. I might use something for them to focus on, to build concentration. I might even use sound or the texture of the environment as a way for them to bring their attention inside. I'm going to ask them if they're wanting to explore breath as a modality for self-care, what is a reasonable amount of time, or what is a place to start with practice, so that whatever plan of care I give them has the potential of being followed through on. So I'm not going to give them, you have to do this for a half hour a day, 5 days a week, if that's just not something that they're going to be able to weave in. Typically, when I'm starting with introducing someone to a breathing practice, I'm talking about like 7 minutes a day, or that 1 minute practice I mentioned at the beginning, where it's like you set a timer and you just stop. So you're just building that relationship slowly. And honestly, 7 minutes a day of doing a particular breathing practice has a huge influence over time. I am going to offer them, like I was recommending for you all, to just take a moment before you do it and take a moment after you do it, just to notice what you notice. Because oftentimes the breath is more of a sneaky tool in healing, and that we don't necessarily see the adjustments right away, but we start to see things shift in how we operate and how we embrace circumstances in our life over time. So that journal, or that app on your phone that you have, or that place on your computer where you note things, you have the ability to go back, 3 months ago, wow, things have really changed so much. I'm going to ask about if there were any recent surgeries going on. Obviously, there are certain breath techniques that I'm not going to introduce if someone has something going on with their body that might be contraindicated. If someone has a mental health diagnosis or a mental health history, that's going to influence breathing practices that I offer. If someone is struggling with altered states or struggling with PTSD and flashbacks, everything that I give them is going to be concrete to the moment. All the cueing I give them is going to be about grounding in this moment, in this room, in the reality of what is present. If somebody tends to be more creative, or a little bit more organic in how they operate with life, then I might use, kind of a more flowery dialogue, if you will, or more imagery to help them connect to the practice and to build relationship with the practice. And then I'm paying attention just to how that individual is in the moment. You know, what is their attitude about this? Like, is it something that is going to be useful to them? Is it something that resonates with them? So ideally, as we move through our day, you know, over the idea of healthy living, healthy being as we move through our day, ideally, our breath over the course of the day, even though it's going to change tempo, it's going to change rhythm depending on what we're doing, it has that ability to come back and be calming, be multi-directional, be moving from the diaphragm primarily, not from these secondary breathing muscles with chronic tension, to have an effortlessness, to have a kind of weaving us into the environment, helping us maintain our ability to be present in the moment. And the use of it, the use of it as a tool, it starts with us. It starts with us individually, and the sensitivity that we bring and the things that we discover. The breath as a tool for modality is, I feel like it's still so much in the discovery stage of how it can be applied in different ways. There's a lot of research coming forward, but there's a lot of room to dig in more and to understand more, and our ability to utilize it as a tool ourselves as practitioners, you know, gives introduction into the field about other ways that it might be applied or utilized. So with that, are there any questions?
Thank you, Kelly, for this presentation. It's very helpful. If audience here have question, please type in the chat, or you can also unmute yourself and ask. I do have a question. So for beginner to learn breath, is there any book that you would suggest?
Absolutely. I actually listed some books here. I'm a huge fan of Doug Keller's work. He's a wonderful teacher. He has a book called Refining the Breath that I often use. At the school, we use the breathing book by Donna Farhi and Prana and Pranayam. Those are the two primary books that we use. There's a breath chapter that I just wrote in the integrative rehabilitation practice book that Matt Erb just put out. It came out this spring. And then there's, you know, you can always Google, there's all sorts of stuff online these days as far as breathing practices. Jill Miller has some interesting videos online where she talks you through, she's a lot of enthusiasm for breath as well. And so personally, I recommend if you are interested in having a breathing practice that you find a teacher to work with directly, that you can work with consistently and have open dialogue with, so that they, you know, they have experience with the breath, they've gone through it themselves, you know, they've been exploring in different ways themselves. And so they can be a guiding force and a, you know, kind of a inspiration for curiosity. Breath, you know, breath does bring things to the surface. Like you know, it is this hinge from the conscious into the unconscious. And so it is nice to have support around exploring breathing practices, have guidance.
Great, I'll jump in next. We have a question from Anna Marie. It says, for the sympathetic parasympathetic breath, a few questions. Do you continue tapping on the pause between inhale and exhale? That's part one. And the second question is, do you tap with alternating hands or tap both hands in synchrony?
So I don't tap in between. So once I've let go of the breath, I stop tapping and I just take a moment to register into my body, kind of relax, notice, and then I go into another cycle. This is actually a really fun breath to do with someone else because they can tap more of the back body, which is where we have more lung access in the back. So they can kind of give you a really good tapping on the back. What was the second part of that question, Matt?
Do you tap with alternating hands or tap both hands synchronously?
I just vigorously tap as much as you can. So while you're holding that breath in, all the attention goes to, like, I'm a huge doing fan using fist. It's very stimulating for the nerve fibers in the body, kind of percolating. But yeah, there's not a prescriptive rhythm. There's just kind of going in and going for it.
Okay, we have a couple of other questions here. The scientific or more biomedical view of breathing and the impacts that it can have on our health seems pretty clear. The idea of breathing as related to like life force or energy or spiritual domains can be confusing for some based on language or cultural understanding. So is there a way to explore the yoga teachings view of the breath as sort of an interface between that realm without people necessarily thinking that the metaphysical views of breathing are unscientific or, I'm just curious how you work with that.
Yeah, so as a yoga therapist, one of the things I love about that particular modality is that I'm not imposing any particular belief system on someone. Like, I'm not saying like this is how the world operates. I experience yoga as an invitation for discovering our own belief system and really clarifying and being able to articulate that for ourselves. So I feel like my role as a facilitator is to listen to a client, to either use inquiry to kind of tease to the surface their belief system if they have one, if it's somebody who practices a particular religion or has a particular spiritual practice, to bring that into conversation together. And if they don't, to provide space and to provide inquiry for them to explore that on their own. Definitely, breath is so mysterious. Like, breath is so crazy. Like, we're all breathing the same breath. Breath is sustaining everything around us. So I might weave in aspects of nature, or I might, if somebody is having, we've got so much going on right now with kind of conflict with each other, like the politics and all of that, and if somebody is having a really challenging time with that and is constantly feeling agitated by that, I might say something, kind of nudging or supportive in terms of like, when you're in a situation where you're feeling that conflict with someone, you might, instead of concentrating on the different ideas, you might choose to concentrate on the fact that you're both breathing the same breath and it's sustaining both of you. So there's room for both of those ideas somehow. So I'm going to come in those ways. I'm not going to come in and say like, this is what this means. Does that answer your question?
Yes, thank you. It's very helpful.
I get nervous with PowerPoint presentations. I was like, this is going to be way more than an hour. It's so funny to me that I went so fast through it.
Okay. Anne Marie says, with this kind of intensive breath work, do you find people's baseline unconscious breathing patterns changes at the nervous system or motor memory level? And if so, how do you measure or document change?
Yeah. So I kind of dig into this. So in Donna Fari's book that's listed here, the breathing book, she has some great visual examples of different breathing patterns and how they can affect the physical body. And she has some wonderful invitations for how you might disassemble those. As far as measurement tools, I don't use measurement tools in my practice. It's self-reporting and it's conversation. Matt, can you repeat that question one more time, please?
Yeah, if people's baseline sort of unconscious pattern breathing dynamics changes, is there a way to measure it or document it?
Yeah, I am not sure. I would be curious about that as well. But when I'm working with it as a tool personally, that measurement or documentation comes from self-reporting, and I do strongly encourage, I'm I personally am not a huge fan of journaling myself, but I do more like a 3-word thing so that there's some level of reflection over time. You know, and that can include like, you know, feedback that you're getting either from how you're experiencing your own body, what you're noticing about health issues that you might have, if that's changing in any way, or, you know, feedback that you're getting from others. I joke with students that, you know, you can do a really simple exercise with yourself where you go and you look at your face in the mirror and just, you know, notice what you notice, look at your eyes, look at your skin tone, and then go do like a 10-minute breathing practice, and go back and look at your face. And there typically is a pretty startling kind of shift in your own presentation.
So we
that's a question, yeah.
Yes. We have another question. With this kind of intensive breath work, do you find people's baseline unconsciously breathing changes?
Well, that's the one we just asked.
Oh,
It's the one, the one above it.
Yeah, changing one's breathing pattern, even if considered dysfunctional, can sometimes paradoxically cause feeling of stress and anxiety. Can you say a little bit about how you work with this, if it shows up when teaching breathing practice?
Yeah, that's a great question. So we all have different reactions to interfacing with our breath. Like for myself, I can't count my breath. Like there's a lot of great techniques around incorporating different counting on the inhale, counting in the hold, counting on the exhale. For me, counting the breath, it brings me right back into kind of more of a trauma state. And so the using this as a therapist, using this as a healing modality, it all has to be based on meeting the individual where they're at and permission to, you know, stop the practice, to try the practice in a different way, to stop it, let the breath breathe your body as it needs to, and then pick it back up and explore it, to say like this breathing technique just doesn't resonate with you, let's try this one instead. There are multiple breathing patterns to address different symptoms that are there. And so it's not like a hard, fast rule that this is what you have to learn to do and this is how you have to learn to do it. The overall intention of any kind of breathing practice is aligning an individual with their own inner rhythm so that they're more in flow with their kind of natural big P prana, we call it in yoga, like their own natural life force inside. And so all the cueing ideally is in reference to, you know, watching and feeling and allowing and nurturing. You know, and with that, there are, you know, the more fiery breath techniques, you know, can be more challenging to connect into or to understand the dynamics of. Even with those, they're started gently and slowly and mindfully.
Great. And Victor had his hand up and he just typed the question in now for me. So considerations, this will be our last one too. I'm looking at our time, but considerations for negative responses, safety, like if people get lightheaded or feel like they might pass out or something, to be aware of or to prepare for when you're working with people for breathing. So in other words, he's saying the positive benefits are talked a lot about, but any adverse, and I think that links to this last question, is there anything people can do to sort of prepare or you know, consider how to respond if someone has an extreme or adverse response?
Yeah, I do recommend working with a coach, working with someone directly where you can, you know, kind of talk about how you're experiencing it, talk about the effects of it, tweak it so that you're kind of working in a direction that's most beneficial to you. As far as incorporating it into practice, starting super slow, building yourself up slowly, giving the body an opportunity to adjust to this new method that you might be using. You know, I remember having a peer when I was living at Kripalu who was just very fiery about wanting to take on all the teachings. And you know, you can compromise your nervous system if you do too much too fast. And so being respectful of your body and being respectful of the practice itself and starting slowly and having support around that.
That's great. Yeah. And that container of the therapeutic relationship to explore these things is really where that safety comes from.
Learning, right? Like I'm learning from my clients all the time, and you know, they're learning from me too. So it's this mutual exchange.
Yeah. Sort of teach me what you need in a sense, you know. Yeah. Great. Okay. Well, that's our time. So we want to thank you so much for tuning in with us today. Again, this video will be up on ACRM's YouTube channel very soon, so usually within a few days. So we'll let our audience know about that. And thank you again. So have a wonderful day, everyone. And we'll see you at our next webinar.
Thank you. Thank you, Matt.
Thank you. Bye.
Bye-bye.